Welcome to For the Health of It, Because You Can, where host Susan Robinson dives into the 8 categories of wellness with experts from various fields. We offer tips and information to help you thrive in all areas of individual wellness.
Hi, everybody. My guest today is Dr. Thomas Nunn. He is our current Chief Medical Officer for Health Choice PPO and is the former medical director for the Oklahoma Healthcare Authority's Medicaid program. I've asked Dr. Nunn to speak to us about the importance of self-care and annual visits to your primary care physician, including the different screening tests. I think during the pandemic, these visits actually went to the back burner for many people, and I'm not totally sure, but I think this is still going on, that people are still not taking care of themselves as far as keeping that as a part of their life where they go see their physician and get annual screenings. So, Dr. Nunn, explain to me why it's important to go see your doctor annually.
Overall, well, we're calling this wellness visits now, where you go once a year for your wellness visit. And this seems to reduces your risk of disease, disability, and even death. It reduces your risk of getting sick because you can kind of be proactive a bit. It increases your risk chances for treatment and cure of a disease because you did get in to see someone and not just hoping it goes away on its own. They've shown that it can increase your lifespan as well as your overall health and potentially decrease cost in the long run. Was it Benjamin Franklin said an ounce of prevention is worth a pound of cure? And so we think that some of this preventative stuff is going to save us in the long run.
Yes, I agree. What can people expect at a regular checkup, this wellness checkup? What can they expect to happen during that time?
Right. And remember, this wellness, the focus is a little more being proactive than just reactive. You're not just going because you have a sore throat or you have a cut or something. This is trying to be more of a proactive visit. So basically, the physician or your provider does a health history, your past medical history, past surgical history, and helps you develop a health plan going forward based on your needs. Usually there's some blood tests involved, immunizations perhaps if you're behind on your immunizations. They perform a physical examination, and that's a little different in men and women as what the physical examination would entail. And there's some counseling as part of that visit as to how you can help in your diet, in your exercise, in your lifestyle going forward. Right.
So explain about at-risk populations. You hear that a lot on TV news reports about at-risk populations. Can you kind of explain what is at-risk populations or who are at-risk populations?
Certainly, and that came up a lot during the whole COVID-19 pandemic as they talked about at-risk populations. So basically those patients or those adults, if you will, that are being chronically ill or disabled are at risk. Also, those low income or homeless seem to be more at risk. The LGBTQ community is an at-risk population. Those at extreme ages, the very young and the very old, are much more vulnerable, if you will, and certain geographic communities, especially those in rural areas that have a lot of risk factors. Sometimes it's income and access to health care. The American Indian population, the Native American population, is also considered an at-risk population.
I did not know that. All right. So we talk about genetic predisposition. Can you kind of explain what that means, being genetically predisposed to have illness?
That refers to having an increased risk or chance to develop certain diseases based on your genetics. And really, they think that maybe 5 to 10% of cancers have a genetic basis right now, but there's other things that are genetic as well. Certain breast cancers are genetic. Diabetes type 2 can be genetic. We know of Down syndrome is genetic. Sickle cell can be genetic, some osteoporosis. There's a number of things that because of your genetics, your genetic makeup can put you at increased risk.
So let's say if someone is genetically predisposed to a certain disease or cancer, does that mean they will actually have the same health issues, or can this be prevented?
Well, you can definitely stave it off. I'll put it that way. You can have genetic things that they call them recessive. That means you might get it, but not necessarily get it. There are ones that just increases your percentage of maybe instead of a 10% chance of getting a certain cancer that may be the general population, it could be a 20%. So it increases your risk. And there are definitely things or steps you can take, and a lot of it has to do with early screening. For instance, if you've got a family history of colorectal cancer, then getting your routine colonoscopies or testing can be impactful. If you've got a family history of breast or ovarian cancer, making sure you get your pap smears and your mammography and regular checkups are impactful. If you've got a history of heart disease, same thing. Being proactive before it's a problem, you may be able to delay or even prevent those things from happening. Same with diabetes, same with osteoporosis. Yes.
Yes, I've heard many times from people, well, yeah, I have diabetes because my parents had diabetes, and those kind of things. And so I keep thinking, but it is preventable, I do believe, if depending on what you do with your lifestyle.
In many cases, that's true.
Right. So people tend to see the doctor only when there's already a problem. How does that change the appointment as far as being able to have time to talk to people about prevention and the screenings or getting their vaccines if they wait until it's already an issue?
I think it's important to know that when you schedule a preventative or wellness visit, your physician or your provider actually blocks out extra time to address all of these issues. So often when you have, let's say you've got a sore throat and you go in, that's more of a problem-focused examination where they address the problem, but they're not actually addressing the whole picture. And so it's important to have these wellness visits to have the plan and for you and going forward on to maximize your health. And it also makes those problem-focused visits more impactful because your provider already knows you, already knows your health issues, and can better address the problem.
Right. So again, I know this probably sounds like a broken record, but how important is those preventive screenings, and who should really get those done? It's probably repeating myself, but I think it's an emphasis that we need to address.
Let me start off with who should get those done, and that's everyone, and that's children. There are preventative health screenings for children, and a lot of that has to do with developmental milestones, immunizations, all those sorts of things. We should continue those as long as we live because as we get older, remember extremes of age, we're at risk for even more things. Let me just, if you don't mind, talk about a few screenings. And one that we talk about a lot is colorectal cancer. And I shared this story with you earlier, but I had a friend who died at age 46 of colon cancer. At the time, the recommended colon cancer screening was 50 years of age. They've lowered it now to 45 years of age. And there's a number of different ways to do the colon screening. But why this is so important is colorectal cancer caused almost 53,000 deaths so far this year. So it's a big deal. And a couple people that you may or may not know, Chadwick Boseman, who was in Black Panther, died at age 43. Jackie Robinson, the baseball player that's famous, died at age 43 as well of colorectal cancer. Audrey Hepburn, there I can go on, but there's a number of famous people who have access to health care, but yet you wouldn't expect it at a young, getting this at a young age, but it definitely happens. Almost always colorectal cancer comes from colon polyps. And so when you have the testing or the colonoscopy, if they see a polyp, they can actually remove those at the time, and that may prevent future cancer. So the polyp can be removed before it turns into cancer. And then the current recommendations are everyone from age 45 to 75 should be screened, and some recommendations are continue it after age 75 as well, but definitely those ages. There's other tests besides colonoscopy, although colonoscopy is kind of the standard. There's such a thing called a CT colonography, I guess, that actually can see it without actually doing the full colonoscopy. There's also a DNA test you've heard advertised on TV that's available too. So that's a big one. Hypertension is a big one too. It's sometimes called the silent killer because people can have a high blood pressure and never know it. My grandmother actually took blood pressure medicine, and she took her blood pressure medicine sometimes, and she would always say that she could tell when her blood pressure was high, and so she would take her blood pressure medicine. In hindsight, what she was probably feeling is she knew when it was sky high, and took her blood pressure medicine. So that's why, again, they call it the silent killer, and approximately 1 in 3 American adults have hypertension. They may not know it, but 1 in 3, and so look around, and that's a lot. So that's more than 100 million people. Often develops in your 30s and 40s. So 30s when you're very healthy and you don't think much of it, and you're not going to know if you don't get checked. Obesity can be a contributing factor, and age definitely contributes. So even though it can be developed early in life, it seems to get worse, or other people develop it only as they get older. It does increase your risk of heart attacks, heart problems, stroke, and other diseases. The other one I wanted to talk about was diabetes. And diabetes is also, 1 in 3 people that have diabetes don't know it. The symptoms can be excessive thirst or excessive urination, but the point is it may not cause symptoms that you would recognize. But it can cause an increased risk of stroke, heart attacks, peripheral vascular disease, kidney disease, blindness. So it's important that if you've got diabetes or even there's a condition called prediabetes, that it gets diagnosed and addressed because some of the consequences, can be deadly if not at least increases your morbidity in life. Yes.
I read a few years back that 1 in 4 Oklahomans have either diabetes or prediabetes. And that's a very high number, 1 in 4. So, diabetes is one of those things that we just don't, again, not going to the doctor, not having things checked out, not paying even attention to our own bodies. When I think our own bodies actually will tell you if something's wrong, and you just should not ignore it.
Well, right. But you don't want to just depend on your own body telling you.
Right,
because that's, once again, some of these are so silent. The hypertension, sometimes the diabetes, you're not going to know if you don't get screened.
Right. All right. I kind of want to finish on how important is lifestyle in prevention and in the management of disease?
Many diseases are as a result of some risk behaviors that we've developed, whether that be smoking is a risk behavior, unhealthy eating, certainly, and I think a lot of Oklahomans, me included, is guilty of that. Sedentary lifestyle. Most Oklahomans, I'll say Americans, but Oklahoma is rated in most of these rating things as in the bottom 10 or at least bottom 20 of health outcomes. And a lot of this is what we're addressing here on these risk behaviors. So sedentary lifestyle, we should get out and move more. And then excessive alcohol use is another risk factor that I think a lot of people don't think of as a risk factor. And I'm not saying an occasional drink is not okay, but excessive alcohol use does increase your risk of heart disease and a number of other liver disease, other conditions like that. So making healthy choices decreases your likelihood of developing chronic diseases.
Right. And I've heard from people that actually had a family member with diabetes that one of the things they did in a education class was they took their glucose count, then had them go for a walk and come back and take it again so they could see how movement is really important in managing diabetes. That was interesting. There's things that I've learned today that I didn't know. I appreciate you taking time to come and do this podcast with us.
Well, thank you for having me.
You bet. Thank you, everybody.
Thank you for listening to For the Health of It. For more wellness tips, information, and videos, visit the Thrive webpage. For questions, contact us at thrive@omes.ok.gov.